Hello, dear students. Namaste. This is Dr. Meenakshi. So, as I was posted one short few months back that I'm going to start the classes of Kaumarabhritya topics according to new NCISM syllabus. So, here I am. Today, I'm going to explain the first point of our Kaumarabhritya syllabus. As you all know, Kaumarabhritya comes under third phase of BAMS syllabus, and this subject is of only single paper, not two papers, and it is for totally 100 marks. So let's start the first topic of our new NCISM syllabus. So initially, introduction of our Kaumarabhritya. What all points they gave in our syllabus topics, that is, as we all know, according to new NCSM curriculum, they gave a syllabus copy in which particularly about topics and its subtopics all they explained point to point. So in that first point, that is introduction of Kaumarabhritya, they gave or they explained to inform about definition of Kaumarabhritya, scope and importance of Kaumarabhritya, and terminologies used in Kaumarabhritya. First point. Secondly, they inform to explain about the Vayobhedas, that is classification of age. Coming for introduction of Ayurveda, in ancient times, the study of Ayurveda was not split into branches. As we all know, before the division of this Ashtanga Ayurveda, it was studied as whole Ayurveda. Only Ayurveda it was studied. After few years, when they felt like we should study particularly about different parts of the Ayurveda, then they divided the Ayurveda into 8 angas, that is nothing but or ashtangas of Ayurveda. So this splitting of the phenomena, splitting of this Ayurveda was known as reductionism. That is, they divided the Ayurveda into 8 branches as Ashtanga Ayurveda. So this entire Ayurveda is divided into 8 branches. That is, we all know, like we will study this in first year only. That is Kaya, Bala, Graha, Urdhvanga, Shalya, Dranshtra, Jara, Vrushaihi, Gatamashtanga, Gatam, Punyam, Bubudeyam, Pitamaha. Our whole Ayurveda is divided into 8 branches according to our Acharyas. But as we are dealing with this Kaumarabhritya subject, our Kaumara, that is branch of pediatrics, took its own seat in this Ashtangas. In Rigveda and Atharva Veda, two several pertaining the branch of Kaumarabhritya are explained. Even in Puranas like Garuda Purana, Skanda Purana, Ramayana, these all classical texts have the references of Kaumarabhritya. So why I am saying, because see, even in those classical texts, they mentioned separately the branch of Kaumarabhritya. So much importance they gave for pediatric branch. But this was about our Ayurveda. But what about modern? In Western medicine, the branch of pediatrics came into existence only after George Armstrong wrote a book, that is when in 1770 to 1789, an essay on the disease most fatal to infants. And only the separate branch for pediatrics or about the infants they got to know. That is in 1770 or 1789. And this IAP, Indian Academic of Pediatrics, was established in 1962. Whereas George Coley, father of Indian pediatrics and father of American pediatrics, is Abraham Jacobi. So this is a small brief knowledge about the modern pediatrics, and we can compare when the modern pediatric branch was started and when our acharyas or our classicals mentioned separate branch for our Balaroga. So obviously this development of Ayurveda in Itihasa first year only we will come to know. But how our Pradaya, Kashyapa Sampradaya started, that is obviously we know from Brahma, Daksha Prajapati, from Daksha Prajapati to Ashwini twins, that is Ashwini Kumara, then Indra. But from Indra it was bifurcated as Atreya, Dhanvantari and Kashyapa. But whereas in Kashyapa Sampradaya, from Kashyapa to Vashishta, Atibhrga and Kashyapa, who is the founder of Samhita, and Vriddha Jivaka, Anayasa Yakshu and Vatsya. These all were the disciples of our Kashyapa. From Indra, this Kashyapa one, who is the founder of the Sampradaya, got the knowledge, they explained for their disciples. Like these, our Ayurveda took place or got existence. From Ayurveda, the branch of Kaumarabhritya started. So places of Kaumarabhritya and Ashtangas according to different authors, because As we know, Ashtanga are explained from all authors, but all mentioned this Kaumarabhritya place in Ashtanga in a different manner. As in according to Charakacharya, for Balaroga, that is for Kaumarabhritya, they gave 6th place. Sushruta Acharya gave 5th place. Vagbhata Acharya gave 2nd place, whereas Kashyapa Acharya gave 1st place, because obviously Kashyapa is the author of our Kaumarabhritya. So usage of this word, terminology of Kaumarabhritya in different Samhitas has, in Samhitas has they mentioned, in Charaka they mentioned Kaumarabhrityaka, in Sushruta they mentioned Kaumarabhritya or Kumara Tantra, in Kashyapa Samhita they mentioned Kaumarabhritya, and in Vagbhata and Harita they mentioned as Bala Chikitsa. So why this pediatric has a separate branch? Why we want separate branch for Kaumarabhritya? We can study in Kaya Chikitsa only, or in PTSR only we can study a part of pediatric, right? Why we want separate branch? A child, an infant and a newborn differs from adults in many ways. We all know, right? And it is relatively a challenge for the pediatrician to understand and treat, especially as a child cannot explain his symptoms. We know children are in two forms, Swatantra and Paratantra, right? Till 5 years, the baby will be Paratantra, depending on the guardians or parents. After 5 years, the children will become Swatantra. Though after 5 years they become Swatantra, they can't explain whatever they are feeling or the complaints of the body, they can't explain. The parents should understand their symptoms and they should say, or they should, on behalf of students, on behalf of kids, they should explain, right? So it is very difficult task as a person to understand the changes in a pediatric age group and to treat them. So we need a separate branch. Then many think enormously that general medicine and pediatrics are same, but has the dhatu, dosha, everything changes from adults to infants. In infants, it may be, if we take modern ossification of bones or the development of organs, these all also changes, right? So according to this, we need to study separately about the changes of pediatrics, and in adults it will be totally different. Many persons or many people think in a different way, but there is a particular need of separate branch of pediatrics. And mainly they will be having a paripakwa dhatu, right? As a child will be having a paripakwa dhatu compared to adults, so maybe medicine, food, etc. should be less, and to understand the children's concept separately, we need a separate branch. Obviously, to understand their dhatu poshana or to understand their changes going on in their body, we need a separate branch. So separate technical terms used in a regular, in a classical to explain about the baby. In routine usage, the words Shishu, Bala and Kumara are being used as almost synonyms. Whereas, what is Sishu? Sishu means Adikena Seta iti Shishu. Means child takes excessive sleep, so it is called as Sishu. Whereas Bala, Balena Nyuna iti Balaha. In children, there will be less strength and it's increasing day by day. And another explanation for Bala, Balati Alpayasena Balaha, means children survive with less exertion. Ashodashat Bhavate Balaha, means Bala is refers to a age group, till age group of 16 years. So next, coming for Kumara, Kumara also used as in a regular basis, the terminology used as Kumara, Kutsitaha Maraha Yasmin Saha Kumarukaha, means children will be having a deficiency of reproductive potentialities. Kumarayatiti Kumaraha Kumara Kridayama. During this period, they play more, so they are known as Kumara. Ashodashat Kumaraha. Kumara refers to up to the age of 16 years. So those were the terms used for a baby. Now coming for terms used usually for newborns. In newborns we have different stages of newborn. So those are explained as Jata Matra Sishu, means refers to the baby immediately after birth. Sadhyo Jata Sishu refers to a baby of the first 24 hours of age. Navajata Sishu can be referred to a baby of 120 days. So immediately after birth, the baby is known as Jata Matra Sishu till cutting of umbilical cord. Later, from cutting of umbilical cord till 24 hours, till completion of 24 hours, the baby is known as Sadyo Jata Sishu. Later, after 24 hours or from birth till 120 days, the baby is known as Navajata Sishu. So modern technical terms used for regularly in a pediatric age group or while explaining the pediatric topics: gestational age or prenatal, perinatal, natal, postnatal, neonate, infant, toddler, childhood and adolescence. Whereas gestational age is the pregnancy age 9 months, perinatal is during a birth or before the delivery, natal means immediately after birth or immediately coming out of a womb, postnatal after delivery till 1 month the baby is known, that stage is known as postnatal, and neonate again the baby from birth till 30 days 1 month the baby is known as neonate. Infant, a baby from birth till 1 year baby is known as infant. Till 3 years baby is known as toddlers. Obviously till 5 years childhood, and after getting the menarche or after attaining the puberty they are known as adolescents. So coming for definition of Kaumarabhritya. Kaumarabhrityanam Kumarabharana Dhatri Kshira Dosha Samshodhanartam Dushtastanyagraha Samuttanam Cha Vyadinam Upashamanartam. In Sushruta Samhita, in Sutrasthana, first chapter, 7th shloka, they explained about the definition of Kaumarabhritya. Whereas our Acharya Sushruta explains the branch of Ayurveda which deals with the following categories will be termed under Kaumarabhritya. That is Kumarabharanam, Kshiradosha, Shodhana Kriya of Dhatri. Mother treatment of Dushta Stanyaja disorders, treatment of Grahaja Vyadis. These all terms will come under the group of Kaumarabhritya according to Acharya Sushruta. Acharya Sushruta in another context adds some more duties to the term of Kaumarabhritya, has diseases of Shukla and Arthava will come under the definition of Kaumarabhritya. Topic of fetal growth and development will be included in Kaumarabhritya. Whereas they explained initially Kumarabharana, Kshiradosha, Shodhana Kriya of Dhatri and treatment of Dushtasthanya and Graha will come under Kaumarabhritya. But while explaining the other things, even Sushruta added these Shukla and Arthava and growth and development also will come under Kaumarabhritya. Second definition of Kaumarabhritya is Garbhopakrama Vijnanam Sutikopakramasthata Balanam Roga Shamani Kriya Bala Chikistitam. It is explained in Harita Samhita. Kaumarabhritya is all about studying main two topics, that is proper antenatal care and proper postnatal care. Those both are definitions of Kaumarabhritya. Whereas our Acharya Kashyapa didn't explain the definition, but they explained the importance of Kaumarabhritya, why this branch is so important. Kaumarabhritya Mashtanam Tantranam Madhyamuchyate Ayurvedasya Mahato Devanamiva Havyapaha. That is Kashyapa Samhita Vimanasthana 2nd chapter 10th shloka. Acharya Kashyapa explained Kaumarabhritya is considered to be the best among 8 angas of Ayurveda. Likewise, Agni is Shreshta according to Devatas. They compared this Kaumarabhritya to Agni. How Agni is Shreshta according to Devatas, like that Kaumarabhritya branch is Shreshta among the 8 angas. Because in the field they treat a person in the initial stage of life, later all other angas will work. As our Acharya Kashyapa saying, pediatric branch, this branch work or duty of this pediatrician starts immediately after birth. After birth, when you make them stable, then only all other angas will come, right? So that much importance they gave for Kaumarabhritya. So according to modern, the definition of pediatrics is, it is the study of the child from conception through childhood to adolescence. That is, pedia is child and trick is treatment. Treatment of the child from birth till adolescence is nothing but pediatrics. So how does a child differ from an adult? How they will differ? In modern advances, the differences between the children and adults are anatomically they will differ, Physiologically they will differ, pathologically and immunologically. Whereas same topic, if we take in a Ayurvedic concept, in Ayurveda we will say the explanation of pediatric, explain the Kumara or explain Bala is, they will be Sukumara means like very sensitive, Aparipakwa dhatu, they will be having Aparipakwa dhatu, Ajata Vyanjana means devoid of reproductive systems, Alpakayata, compared to body structure, they will be Alpa, less body structure, Sarvanna Anupasevata means they can't have all sorts of food like adults. We should see according to their age, according to their digestion capacity, according to their tolerating capacity, we should advise, or especially according to their age group, the ahara food will be differing, whereas in adults all sorts of foods they will eat, right? So till now we saw the topic of introduction to Kaumarabhritya and terminologies used in Kaumarabhritya, and our next point is about the Vayobheda, which I'll explain in coming video, next video. So this was about the introduction and terminologies used in Kaumarabhritya. So hope the video was very helpful for you all. If you like a video, kindly share with your other friends of other colleges so that they too will have benefits of this video. Also, from now I'll be explaining a point was different topics of Kaumarabhritya syllabus and even the topics of Ayurveda, which I'll be easy to explain, or which I feel our Ayurvedic students should know. So if you liked the video, kindly subscribe to my channel and also share these videos with other BMS students so they too will get help. And even if you want any other particular topics, you can comment in my comment section box. I'll go through, I'll make a PPTs and I'll explain. The motto of this videos is nothing but has practically I should grow my YouTube channel, and another thing is all the students of Ayurveda will get benefits of this. And also with this note, if you want any changes in my explanation, you can freely comment in a comment section box, because the videos will be helpful when you can understand my explanation, right? So all sorts of comments are welcomed. Thank you.